Hi guys, and welcome back to my channel. This is Ashley if you are new here, and I am here to do a follow-up video on the other day, the video that I posted the other day about what I packed in my baby's hospital bag. Now I know that a lot of you who watch that video are thinking that girl is so extra. I totally am. I just want to have everything I want for him at my fingertips when I want it. So that's why I do that. This video is going to be what to pack in your hospital bag. So what is necessary and what is not? Isn't that just very, it just depends on the person, right? I mean, it really does. Some people go all out. Some people pack makeup for days, and some people don't pack makeup because they say they're not going to wear it. Some people don't do any hair tools or anything like that because they say they're not going to do it. Anything like that is perfectly fine, okay? But these are some things that you might not think of that I feel like you will regret if you do not pack. And these are the things that I am definitely packing in mine. I might or might not do a separate video just showing you what I end up packing and what I leave behind. But we'll see. I haven't packed my hospital bag yet. We're not quite there yet. There's still a few things that I want to pick up from the store for us, and I'll kind of mention those things as we go along. So, okay. I just gotten ready, and now I'm like so out of breath, and I'm huge, and I can't sit down very comfortably at this point in my life. Okay. But I want to kind of bring to your attention, especially if you're a first-time mom, or especially if you know somebody who's pregnant, and I'm sorry, that vacuum in the middle of the thing is going to drive me nuts. If you're a first-time mom or someone who knows somebody who is, it's some things that you might not necessarily think of, okay? So the first one I have for you is definitely comfortable clothing, okay? Yes, you can totally wear the hospital gowns that they give you or provide for you. Yes, you can totally order custom hospital gowns if that's your thing. But I find that I just want the stretchiest, softest clothing for myself. I am the kind of person that I do not like sleeping in long sleeves. So I'm not going to pack long sleeves to sleep in, okay? I'm going to pack myself loose fitting, but not too loose, so it's wrapped all over me when I'm trying to sleep. Clothing that is going to be nice to my belly, that is going to be nice to areas that I need it to be nice to. I want it to fit there. So I don't really prefer gowns and things like that, because I prefer to have pants so that I can have something fitted so that I don't feel like my underwear is falling off and all the grossness is everywhere. Like, that's my personal opinion. Now, I know there's a lot of controversy about bringing your own underwear, bringing your own clothing, all of these things, because you could get them gross and messed up. I've never had that issue. That's just personally me. I've never messed up my underwear while I was there. Yes, you're gonna have heavy bleeding, but it's not gonna be so bad, in my opinion, that like if you know what you're doing and you change it ever so often, you'll be okay. That's my opinion. Now, yes, maybe when you sleep, you might have an accident or something like that just because you don't know how heavy the bleeding is going to be. And yes, they're going to push on you and make it come out much more. I know, TMI. But if you're a mom, then you already know. They're going to push on your cervix and things like that. And it is going to cause it to be very heavy. But I've never had issues with like just gushing all over my clothes and then my clothes are ruined and I should have never brought these $1,000 panties to the hospital. Like, I bring some that I don't care that much about, that's going to give me a lot of coverage, and that's going to make me feel comfortable and secure. I want everything to feel super secure so that I don't feel like everything's loose and it's in danger of me making a mess all over the bed. Like, that's just my opinion. Same goes with pants. I like to have pants on so that I feel like I'm secure and everything's okay. That's my opinion. That's my preference. It's all about preference. You have to think about your preferences, not what someone else is telling you, not what you read on Instagram or you looked at a Pinterest list of things to pack and all of those kinds of things. Yes, that's great, and it's great to take mama's opinions into perspective, but you need to think of what you like. What do you like? What makes you most comfortable when you're pregnant or not pregnant? You know, what makes you the most comfortable? Are you comfortable in a gown? Are you more comfortable in pants and a t-shirt? Are you comfortable in shorts? Are you comfortable in pants? What are you comfortable sleeping in? Because you're already not going to get a lot of sleep as it is, okay? They're going to be coming in there every 2 seconds. They're going to be checking your vitals. They're going to be checking the baby. They're going to be checking for this. They're going to be doing that. The lactation consultant's going to be bothering you if you decide to breastfeed. They're going to be pushing on your cervix every few minutes, and you think you've gotten a rest, and then lo and behold, they've come to bring on the pain. Hopefully you have a sweet nurse who's not too brutal, but holy Jesus above, it does hurt. You're going to have all of these things, so you're not going to rest very well anyway. So you want to make the most comfortable experience that you can possibly have, okay? I've been in the hospital where I have only stayed one night, depending on when I went into the hospital when I birthed the baby. I have done it where I've stayed 2 nights, and I have done it where I've stayed 3 nights, and the 3 nights really sucked, okay? Which leads us to our next thing. I would suggest, if I were you, and we are doing this for the first time, you guys. Are you kidding? For the first time. Of the times that I have been in the hospital birthing a child, this is the 5th time, and this is the first time we are doing this. We're bringing something to sleep on, okay? So the little couch thing that folds out is a blessing, and it is wonderful for your husband to be able to stay with you. However, it is hard as a brick, and he's not going to be comfortable. And he's going to be rolling all around and making all of this noise because it's plastic covered so that it can be sanitary, and it's annoying, okay? So the little sheet and blanket they give him is not enough to cover the brick, okay? So it is my preference to bring my own pillows. My husband does not prefer to bring his own pillows, but we are going to buy a mat, okay? So a camping mat. If I think of it, I will put a picture in here. It is a camping mat. It can be rolled up so it can not look like you're moving in or going camping. It can be rolled up really small, and it's not that big of a deal. You know, it's not like it's a mattress or an air mattress, but it is a mat that will help alleviate some of the horrible brickdom. Okay, I'm also going to bring one of those for myself because the hospital bed is absolutely atrocious. And the bar in the middle of the bed, like when you sit up and down, there's a bar in the middle, and it's so uncomfortable. It is so awful. And your body is sore, and feels like it's gotten beaten with a baseball bat. And so it's just not comfortable to be on that hospital bed. It's not going to be comfortable any way you look at it, no matter what you do. It's really not. But bringing your own blanket, your own pillow, and your own mat can be very, very helpful, okay? Because it can just let you rest just a little bit better. What else? I would also suggest, depending on the season you are having your baby in, I would bring slippers, socks, something of that nature, okay? So if you're having your baby in the summertime, which I had a baby at the very end of April, okay, so it was a little warmer. So I brought those little, like, just slide on flip-flops. You can get them at Walmart for like $12, $15, something like that. They're kind of plasticky, but they're loose, and you can loosen them up because you may or may not have swelling in your feet afterwards from the epidural and from all of the water redistributing and all of those things. So I would recommend bringing something of that nature. Also, I doubled them as shower shoes because I don't know about you, but I don't really want to step on wet shower that millions of other people have stepped on. I don't even care if it is sanitized, because that's how you get like grossness, okay? That's how you get fungus in your feet. Like, I'm not all for that, okay? So they can double as shower shoes. They're plastic, but then you can just dry them off, and you can wear them when you're getting up and down to go to the bathroom. You're not going to want to just step on that gross, nasty floor. It's also cold. So it just helps give you a little bit of a barrier. Same thing if you want like socks with the gripper feet on the bottom. Especially if you had a C-section. I've never had a C-section, but especially if you have a C-section or something like that, you definitely want the grippers on the bottom of your feet, because you are going to be a little shaky. You are going to be a little bit weak. You are going to be a little bit, my blood pressure bottoms out and makes me like black out after I give birth most of the time. And then I'm very weak, very drained afterwards. So you may be a fall risk. You don't want to slip and slide on the floor. So make sure you have grippers on the bottom of your socks. But if you are having your baby in the winter time, or even if you're not, most of the time hospitals are super drafty. They keep it cold for a reason. It kills germs, and your feet will get cold, you know. Bring some slippers, bring some socks with grippers, bring some some slide on shoes, whatever. But I definitely do recommend that. The third thing that I definitely recommend, besides your own clothing and your own socks or shoes or slippers, is chapstick and lotion. So it is going to be dry in that hospital, again, because it kills germs. It's a very dry, sterile, cold environment. You want that, right? But at the same time, you don't want to live in it. So that means that you need something that's going to provide moisture for your lips and moisture for your skin. Hold on. Okay, being interrupted. You're definitely going to want something to keep your skin hydrated, because it is so dry. Your eyes get dry, your lips get dry, your mouth is dry. Your your skin feels dry and crackly. It is just dry. You're also I get dry mouth a lot when I am dealing with all of the IV and all of the blood drawing and all of the epidural and all of that. If I have one, which I probably will, if they help you along with Pitocin or anything like that, if you so choose, any medications, it makes you have dry mouth. And a lot of times when you're in labor, they'll give you ice, but they won't give you anything else, okay? Because you can't just be guzzling water. And so I would also recommend mints or gum or something like that to have in your mouth so that it's not so dry. So definitely chapstick, definitely lotion, definitely a mint or gum or something like that. Okay, so that's the third thing. Your own clothing, some sort of footwear that's going to make your feet warm and it's going to make you comfortable and make you not barefooted on the nasty hospital floor. And then some moisturizers, okay? So some lozenges for your mouth or some gum or mint, something, and some lotion and some chapstick for sure. That leads us to another thing. You're definitely going to want to bring your own toiletries, because you're going to want to take a shower, okay? That's literally the first thing that I do after I give birth. Before my legs even come back to feeling, like before I even get full feeling in my legs, I say, I'm taking a shower. And Joshua every single time looks at me like I'm an insane person and says, Ashley, you literally can't even feel your legs. How are you going to take a shower? Like, stop it right now. And I say, try and stop me, because I want to feel like a human again. Okay, that's the best way I can describe it. I feel disgusting. I feel horrible. And I want to feel like me again. Your body feels weird. It feels very funny. Your stomach has been stretched to high heaven and then it's just deflated, but you still got water weight and it's all redistributing and it's all funny, and your uterus is empty, but it's weird. And it feels funny, like a numb, like very strange. Your stomach doesn't feel like your own skin. It feels like blubber. It's very numb and weird feeling. And you just want to feel like yourself. You want to explore you and say, what is this? What am I feeling? What's going on here? How is this working? What's going on? This is my body. It's mine again. It doesn't belong to a hijacker, little adorable human. I have them in the world now. I want to feel like myself, and that's what I want. I want scalding hot water, which you normally don't even get at the hospital, but still, as hot as the water will go. I want to put soap everywhere and just wash it all away, okay? That's me. And it is a lot of mamas that I know and have talked to as well. So that's what I would suggest. Your favorite toiletry items. You don't have to pack the whole bathroom, but your favorite toiletry items. I want to wash my hair. I want to wash my body. I want to wash my face. And then I want to blow dry my hair, and I want to look presentable because I know that people are going to come and visit me. So that's another thing. Whatever makes you feel like you. If it's a face full of makeup, well, then put the face full of makeup on, girlfriend. If it is doing your hair and curling it with a curling iron and styling it and doing all the things, that's not me. But if that is you, go for it, okay? Whatever is gonna make you feel like yourself, you need that, okay? So these first few postpartum hours are very, very important for your mental health, for your emotional stability. Your hormones are going to be going absolutely nuts. If you're breastfeeding, that's a whole other topic, and we will get on that. I am going to do a whole separate video on breastfeeding. So there are so many different components and things that are happening inside of your body and inside of your mind right now. You need to feel like yourself. So whatever it takes to do that, if it takes you bringing 2 suitcases and you changing outfits every 20 minutes to feel like yourself, then go for it, okay? That's the most important thing. And the last thing that I would suggest for you, well, okay, there's another thing too, I forgot. Another thing that I would suggest is snacks, okay? They do have some snacks at the hospital that I have went to for the past few births, that they have a little snack center that you can go to and get, like, I don't know, so many snacks per day. Like, you can get one and your spouse can get one, or you can get 2 and your spouse can get one, or something like that. But you're still gonna be freaking hungry, okay? And you can't sleep because people are coming in and out. And when I give birth, I am hungry as a ravenous bear. Do you understand? I am hungrier when I give birth than I ever am when I'm pregnant, because my milk is trying to come in. I'm using a lot of calories. I've just given birth. There's been a lot taken out of my body. My body's begging to be replenished. And not only that, but my stomach is not full to the brim. And so I can actually fit something inside of it, okay? Other than baby, without being miserable. So I can actually eat and fill up with food instead of having a human inside of my body and trying to find room for a morsel of a scrap of food to fit in here. So I am ravenous. I want all the food all the time. And if you don't have a bunch of different food options around you for your husband to go grab, which luckily our hospital does have a few food options, but if you do not have a bunch of food options, then you need snacks. And not only that, but places aren't open all the time, so you need some snacks and access to snacks. So I would definitely recommend snacks, all your favorites, okay? Grab your favorites, grab your husband's favorites, grab some freaking chocolate, girlfriend, because you deserve it, and pack those bad boys because you're going to need them, okay? Okay, what else? We've got the moisturizing things, the toiletries, your own clothing, the footwear, to make your feet comfortable. We've got our own bedding options, and we have very comfy clothing. What else do we need? Now we have snacks. So the last thing that I would suggest you not forgetting about is your spouse, okay? If your spouse is like mine, then I pack for my spouse. He does not pack for himself. So whatever I bring or forget to bring, he's stuck, and he's stuck with me at the hospital, and there's no other choice. And there have been a couple of births where, I'm not gonna lie, I did not pack him enough things. There have been sometimes we've had to stay an extra night at the hospital. I was not anticipating that. He didn't have enough clothes. He didn't have enough socks. He didn't have enough underwear. And I was like, I'm so very sorry, because you're stuck with me here and you don't have what you need. You don't want to feel like that, okay? You're going to be an emotional basket case as it is. You don't want to feel guilty because you didn't pack them what they need. So definitely pack him some suitable clothes, because he's not going to want to be in pajamas all day like you are when people are coming to visit. That's embarrassing. But pack him comfortable clothes, because it is very uncomfortable in the hospital. Nobody wants to be wearing khakis in a button-up shirt all day at the hospital when they're stuck there for a couple of days. So definitely pack him some comfortable clothing. Pack him very seasonal appropriate clothing. Make sure he has a jacket, because more than likely, if you're like me, especially the last 2 babies, you go into labor on your own, he's panicking. He's not thinking of grabbing what he needs for the hospital, okay? He's just thinking of getting you there so he doesn't have to give birth to your baby in the car. That's the way my husband is. So definitely pack him what he needs as well. And I think that's pretty much covering it. I am going to try to do a what I actually pack and what makes it into my hospital bag, just so you can kind of see me take my own advice and what I decide to buy for us and what I decide to leave at home. But I hope that you enjoyed this video. I hope that it was helpful for you, and I will see you guys in the next one. Bye, guys.